and your life.
Welcome back, everybody. And could I ask you all to remember to vote for the posters that will be closing now. But we are going to go on to our next session. It has been a fantastic day so far, and it reflects the seesaw of events of what a year that we've gone through. So we're here as midwives, we're here to support women and their families, and we have got to be there and to be quite whole in ourselves for what we do. But being a physical and mental and emotional job, it's bound to have an impact on us as midwives, as we're only human. It's unpredictable and can be an emotional roller coaster for everyone involved. And with COVID-19, it adds an additional weight onto our shoulders. The issue is not just about the COVID positive women we've encountered in work, it's the planning, the practicing, the precautions, the changes to our practice for all women. This is what the impact to our already stressful job at times has been. While there's no question about the woman, her baby, and her family being front and centre in our minds, we absolutely have to care for ourselves and our colleagues. We have to do this not just for ourselves, but in order to be the fittest we can be on every level to do our job in a way that women deserve. So, this session is about how we can do just that, mind each other and mind ourselves. Firstly, we have Dr. Sally Pezaro. You may know her as the academic midwife from Coventry University. Sally has an extensive clinical, academic, and research experience, and among her research interests is the development of workplace compassion and well-being. Today, she will present to us on psychological distress in the midwifery workplace. After that, we will have Calodagh McCumiskey, and she will help us to develop some skills to coping in this new normal. Calodagh is CEO of Spiritual Earth and is an accredited wellness expert who believes when we feel well within ourselves, we can perform at our best. So thank you both, and I'm looking forward to it.
Hello, my name is Dr. Sally Pezaro, and I'm here today to talk to you about some of our research that we've been doing into midwife wellbeing, psychological distress in the workplace, and moving towards some evidence-based solutions and evidence-based things that we can do as practitioners and researchers and educators to address the situation and improve our productivity, safety, psychological safety, psychological well-being as a midwifery profession. So I hope you enjoy it today. You can follow me on my social media sites, they're all there. I'll try and move my camera around as best I can so that I don't cover up any of the words as we go along. So my first slide, as I move myself down, I wanted to start by kind of reflecting on my journey through midwifery. So this is me as a student midwife a long time ago, different haircut, style, colour, a lot thinner. And actually during my elective placement as a student midwife, I worked in the Gambia and I've also worked in Ethiopia. And just thinking back to those feelings of becoming a midwife early in the career, the excitement, the joy, the sense of wow, I'm going to change the world, I'm going to do amazing things at the beginning of my journey. But unfortunately, that for me didn't work out in quite the way I'd wanted, and I got very ill in practice clinically, working clinically, and moved into academia as a result, and really tried to reflect on my experiences and think about what we can do to support ourselves, each other, identify psychological trauma and distress in the workplace, and find out how to lessen the impact it has on the work we do. So I just wanted to kind of reiterate, when we start out in this career, we don't intend to get things wrong, make mistakes. You know, we're starting off in the profession to do great things, and the research tells us that. So when things don't happen in the way we plan, or our careers don't unfold in the way we want them to, or psychological distress exists where we don't expect it to, that's where I hope we can make a difference. So early on in my research, I started to think about what really is the problem here, because I had my problems. I had psychological distress and diagnosis of two health conditions in my practice, and I just thought, let's understand the problem first of all. So myself and some colleagues did a review, a literature review, at the bottom, you can see that, to sort of uncover this problem and uncover what was out there in the literature at the time. So we said, there's loads of consequences for the midwife, actually. They get compassion fatigued, vicarious traumatization in the workplace. They get the secondary traumatic stress from caring for people day after day. There's shame, guilt, anger, self-doubt, depression, problematic substance use disorders and other anxiety disorders, and there can be symptomatic displays of unethical behaviour when we see people become snappy or, with the compassion fatigue, lose that compassion they once had in the workplace. And then the consequences for maternity services really are that we're not going to recruit and retain people if they're experiencing psychological distress and not being cared for, or avoidable events being prevented. So we get increased medical error if people aren't very well, increased infection rates, mortality rates, and poorer patient experiences if our midwives are not well in practice. And this review found that there were really two sources of work-related psychological distress, and they were organisational. So things that happen in the workplace, bullying, poor job satisfaction, workplace settings, and then occupational. So the things we can't avoid. There's going to be stillbirths, unfortunately, obstetric emergencies, unexpected things that happen that we can't really control are going to affect us over time. So that was us understanding the problem. And then there was obviously other initiatives looking to ameliorate workplace distress. And there were things like, we know that there's the Royal College of Midwives with the Caring for You campaign. There's also Schwartz rounds out there, where lots of people come together and reflect on the emotional aspects of caring. And also the Royal College of Midwives, I co-authored with them the Safe Places, so workplace support for those experiencing domestic abuse, because midwives are just like any other person in society. If we're going to get mental ill health problems in 1 in 4 people, we're going to get 1 in 4 midwives experience the same thing. So it's really important for me to, whenever we're doing in reflective practice for patients or women or birthing people, we also need to be reflecting on ourselves as a profession. How is that affecting us? So it's really special for me to be able to work with the RCN in looking at workplace support for midwives experiencing domestic violence and abuse. And we'll be having in January a free open online course to support midwives in their own experiences and screening other people for domestic violence and abuse. So this was just one of the things I wanted to share with you today. And then another part of my research looked at help seeking. So we know it exists, this work-related psychological distress in midwifery, and we know there's things out there to support people and looking at help seeking, etc. But in terms of why people don't seek help, we kind of looked into the literature at that, and you'll see what we wrote down there about the confidentiality, anonymity, amnesty for midwives in distress. And really people said, they think they don't come forward to seek support because if they do, if they talk to their PMA, if they talk to their colleague, if they talk to their manager, even their doctor, and disclose that they may not be fit to practice for whatever reason in relation to their ill health, then they will get referred to the Nursing and Midwifery Council and potentially lose their livelihoods and their jobs and their careers. So people can avoid talking about it for those reasons. Also, we have this kind of rhetoric in our profession that the patient comes first. There's patient-centered care, woman-centered care, people-centered care, family services really, and that self-service and self-sacrifice is really there. We go above and beyond, and that's celebrated. We celebrate not just doing our jobs, but going above and beyond. Burning ourselves out is celebrated at times, which I find quite unusual. And also, we're still getting past the blame culture, I think, from what many people tell me. So what we did was look into, okay, well, how could we afford people true confidentiality, true anonymity, and then amnesty if they need to seek support? Because it's better, obviously, for people to seek support than carry on in distress and let those risks remain. So we looked at online interventions, being able to do that. You can be truly anonymous online. And what about seeking help online? We did a Delphi study when we asked 185 experts, if we were going to do an online intervention where people could be anonymous and speak confidentially, what would they need? And they agreed that they would need confidentiality, anonymity, 24-hour mobile access, because obviously they could need support at any times of day. If they're going to be able to talk and share stories on this, it will need effective moderation in the discussion forum. They needed a legal aspect, educational aspects, and therapeutic components to pull all that together for people to have it in one place. And also offering a simple user assessment form if they were to have an online intervention to support them, could direct them to appropriate support. And you can see the paper there on what we found. So really we started to explore, okay, if they need this online support anonymously, how might we build it? And then we looked at existing interventions, because if we were going to build something or design something, we didn't want to replicate anything that was already out there. And if things were out there that were useful, perhaps we could draw on those and bring them in to support midwives. So we did a mixed method systematic review that you can see there, read up on that. And basically what we found was there were mindfulness interventions for midwives, workplace resilience workshop partnered with a mentoring program, and clinical supervision, something like PMAs. And bear in mind, this probably needs updating now because it's 2017. More things have probably come about since then. But people said they were too busy really to engage in these interventions, which were sometimes at set times and places which they couldn't get to. They were given homework, which in some cases which they just couldn't commit to. And again, speaking openly, they couldn't really say what they wanted to say, because if they did, they would be referred to the NMC, or put on disciplinary action, or whatever it was. The consequence was there that discouraged them from truly seeking support. So it was more lip service really to that. And then we said, okay, on the other side of the coin, let's look at what service users see. So we know that midwives are distressed and they can have XYZ consequences, but do women even notice? Do they know that this is going on? And this was a very small study, very small, but it was a small focus group we did, looking at patient and public involvement, saying, okay, look, we're thinking of doing some research into this. We're thinking of supporting midwives. Is there anything you see in practice? And all of them said, they noticed bits and bobs about people crying, people being treated poorly. They witness us treating each other poorly, bullying each other, younger or less experienced midwives rather, being put upon by their more senior colleagues, and they agreed, these midwives do need anonymous support. We'd rather them have support than carry on like this. When the situation was explained. So that was really interesting to find out that this is something they support as well. And then we looked at, okay, what is the immediate solution? Like, we're trying to get funding to develop this online intervention, but what can we actually work on in the meantime? So I published the Securing the Evidence and Theory-Based Design of an Online Intervention Designed to Support Midwives in Work-Related Psychological Distress, which was basically the outcome from my PhD, and a vision going forward. And I'm hoping now I can actually take that forward, but again, I need to secure some funding. But in the meantime, I've worked with some other people who are trying to embody workplace compassion. Now, when we started talking about workplace compassion, people were saying, well, what is it? What do you mean by workplace compassion? What is that? And while there's lots of definitions of compassion, we actually did a study which asked healthcare professionals what they thought workplace compassion was, what showed workplace compassion. So in the bottom left there, you see myself and colleagues having done this study together. We asked people what showed workplace compassion using the hashtag shows workplace compassion, so they could use it in a sentence telling us lots of things about what they saw as showing workplace compassion. And you can see there it's really not rocket science. It's things like, in leadership and management, speaking openly to learn from mistakes. In terms of value and culture, just being heard, valued, being engaged, being caring in your language use, and then small gestures of kindness, and being treated well when unwell is just some of the things that they came up with. So that kind of informed more work with NHS England and others going forward as to how they could perhaps use those findings to inform support packs or tools to help people embody this in practice, because we can all be kinder in practice. So making change happen then, following that study, there was a resource pack to support workplace compassion and a support guide towards commissioning for workplace compassion that was launched with NHS England based on some of this work. And really the idea of it is to get people to embody workplace compassion in the workplace and commission services from people who can demonstrate that they have compassion in the workplace, so that that monetized incentive is there from a business case perspective to ensure that the workplace is safer through compassionate workplaces, which is interesting and exciting. I would encourage you to go and look at those resource packs if you can. And some of the graphics that came from that just outline some of the cost benefits to being kinder and more compassionate in the workplace, which is so important in the reduction of medical errors, infection rates, mortalities, improved safety and patient experience. So this is really getting people to say this isn't just a nice thing to have. This is actually, there's a business case here for things to change. And again, we've got more stats and figures there as to, if we didn't already know that being kinder to each other in the workplace is the right thing to do. But it does pose the question to me, if people are bullying or not treating people well in practice, they're actually increasing risk. And that's a real problem. They're really increasing risk of all these things not being fixed in practice, and less safe maternity services. So I do think we need to be taking things more seriously in that regard. But it really does matter that we care for each other. And this is just one of the final slides that we left on in that body of work, which was, patient experience and staff experience are two sides of the same coin. You can't have one without the other. And I would actually suggest that a lot of the time we actually need to be putting the staff before the patients, because the patients won't get good patient experience in healthcare if the staff aren't cared for. And it's exactly the same in maternity services. So that was a really powerful message we left there. Now, in terms of today bringing you some practical solutions, this isn't my work. This is the work of Watson and colleagues in terms of supporting nurses' psychological and mental health. And it was shared in a conference, and I just think it's just brilliant in terms of practical things we can do. And it might be for nurses, but I don't think there could be any kind of difference in midwives that we would need the same stuff. So these are just some concrete suggestions really about what you can do right now when everybody's struggling. So just talk to colleagues. They may well relate to what you're experiencing. Be aware of your peers. Have you eaten? Have you had a break? Consider buddying systems, noting the staff skill mix there, shared breaks and schedule team offload sessions if you can.
Good afternoon, everybody. Delighted to be here to present on the concept of building back better. While it is a very difficult time for everybody, it's also an opportunity for all of us to redesign our lives and to build better foundations for our future. In terms of the core theme of the conference today, adaptable and responsible, the concept of building back better and resilience are really, really totally relatable to this concept. So I just want to cast our eye and minds back to how things were before COVID. Yeah, it wasn't a perfect world, and we've had all these additional stresses on top. But in April, the British medical journal, The Lancet, said that the mental health effects of COVID-19 could exceed the consequences of the epidemic itself. And we're now starting to see that play out in all sorts of ways imaginable at work, through all these hotlines hopping with people looking to resolve various abuse problems, distresses, etc. So before COVID, in Ireland, 18.5, so almost 1 in 5 in the population had mental health problems. In Britain, it was 1 in 4 experienced mental health problems each year, and 1 in 6 each week. So there were a lot of cracks in how we were living our lives before COVID. And for those people that had cracks that they weren't addressing, maybe the cracks have become bigger. So you add to that all of the physical distancing, the isolation, the frontline working, dealing with stressed mothers, family members who are more stressed maybe than they would have been before, the restrictions, the uncertainty, the rapid change, stress, worry about all sorts of things. One of the most extraordinary thing about this whole crisis is how it's affected everybody very, very differently. Okay. Okay, and so now in the next slide, the impact of the nurses and on the midwives. There's been various studies done around the world about the impact on nurses and midwives. And in the US, there was one study that showed that 87% of midwives in April were actually afraid to go to work. 36% have cared for an infectious patient through without the use of PPE. 11% believed they were well prepared to care for COVID-19, only 11%. So that means 89% didn't feel well prepared. And then on top of that, the welfare of midwives, critical to quality care, was being highlighted by the RCN as appropriate. You know, it's a little bit like that oxygen mask story on a flight. In order to look after yourself, you put on your own mask first. Okay, and then on top of that, normally in epidemics, we naturally see and experience high levels of burnout, stress, post-traumatic stress. There was also a study in Turkey in August, and it showed that 54.5% of nurses and midwives said their lives were worse since the outbreak. 62% had difficulties in dealing with the uncertainty regarding the outbreak, and 42% wanted psychological support, and 11% felt alienated from their profession. And there was a study in Ireland in August, and it showed that 2/3 of nurses are still experiencing post-viral fatigue. So a lot of additional stresses on top of what was already a stressed situation. Obviously, the tiredness is a greater risk to patients and nurses. It adds additional risk to the lives of both, and obviously of the newborns, etc., etc. So in terms of what can be done, the RCN put out different statements, and they were just highlighting the importance of PPE, having regular drinks and breaks when you're on duty, appropriate working hours, not overworking, and having the psychological support, and all of the measures that I suppose that the previous speaker highlighted, all of the really, really positive measures that she highlighted would be extremely beneficial to the natural well-being. Through this presentation, I want to highlight the importance of rest and of recharging your batteries throughout your life and through the session. One last slide on the context. I suppose while it is a difficult situation, it's also an opportunity. And any hidden cracks in our lives before COVID are much more evident as we all spend more time at home. We have more time to sit with ourselves. So even if you're very busy, there's still more alone time, there's more downtime. And while this is a challenge, it's also an opportunity for us to see them and to fix them and to repair them. Certainly, some people are saying that they're significantly more stressed. Some people are actually preferring the situation. They're seeing a silver lining in the current situation for them. And what I want to highlight here is that every situation is unique. But globally, 10% of employees are significantly more stressed. So what I want to ask is, what about you? What's up? What's down? Are your needs being met on a daily basis? You know, maybe before you were exercising in a gym and now you can't do that, or physically, mentally, emotionally, creatively, socially, financially. What's changed in your needs, and are they being met? And maybe just to highlight that for shift workers, if you are stressed, you're more likely to be even more stressed, because normally shift work amplifies any underlying stress tendencies that we have. So even more important that you take that extra time for self-care. Okay, next up, I want to speak about resilience. So resilience is defined as an ability to recover from or adjust easily to misfortune or change. Or it's the ability to bounce back after difficulties. So some of us are born resilient, but it's something that everybody can learn. And when difficulties come in life, we can either be bitter, we can be better, or we can be broken. And sometimes on the way to better happens when we choose to learn from situations and apply the learnings. But very often on the way to better, we can visit bitter and we can visit broken, because we can become resentful of the difficulties that we're experiencing. It's not fair. Why me? Feeling like a victim. Or sometimes we can feel that the situation is simply bigger than us. But I'm sure if you look back over the various things that you've overcome over the last 7-8 months, you'll see many, many examples of resilience. And one of the really important things to understand in terms of resilience is that when we see how we've benefited, how we've applied it, that actually serves to increase our resilience and it gives us more confidence. So the data shows that. So something that each and every one of us can do is, I'm sure at some point you were thinking, I'll never get out of this one, and here you are today. So the key factors in resilience are adaptability and responsive. Learning is implied in both, and that's the theme of the conference. So I'm sure what we're doing now is just reinforcing this at a personal level. So there's 3 types of stress. There's the healthy stress that encourages us to grow, be, and do better. And then, so that could be taking on a new responsibility, going for promotion, running a marathon, learning a new language. It's stress that you choose because you want to make a positive growth want to experience positive growth in your life. And then there's the stress that sometimes chooses us, like COVID. And any of you, I'm sure you're all learning a lot from the situation, from the COVID situation. So even though it's extremely challenging, you're growing from it. Then there's the unhealthy stress. So that's the stress that we generate in our mind through our thoughts, and we generate in our lives through our habits or our actions or our inactions. So that would be somebody drinking too much alcohol, or not drinking enough water, or not making positive choices, food-wise, or not getting enough sleep. So any of those areas can generate unhealthy stress, but I particularly want to highlight the thought part. If I think 3 positive thoughts and 1 negative thought, my mood would be okay. But if I want to actually feel good about myself and my situation, my thought ratio has to be above 3-1. Then there's the stress that kills us from the outside in. So that's listening to too much news, listening to a lot of negativity, etc., etc. So it's important that you don't take on too much stress. This is something that we have a tendency to do, and it's important that each and every one of us just, you see how you are, and you limit your exposure to outside stuff if you know it's going to overwhelm you, that you can limit your self-exposure to. So in sports science, there's a thing called the growth equation for peak performance. And what that says is that stress plus rest equals growth. So the corollary to that is that stress plus no rest equals burnout. And so obviously here we're talking about the healthy stress. So if we're not recharging our batteries, we're on the road to burnout. And when we're burning out, our potential, our output, our productivity, everything erodes and reduces, and our ability to experience joy, happiness, quality connections in our relationships also reduces. So what I want to do now is to introduce you to a practice, an exercise that you can do almost anywhere. It only takes about a minute. So just put 1 hand on your stomach, close your eyes first, put 1 hand on your stomach and 1 on your chest. And I want you to just focus on the feeling of your tummy rising and falling as you breathe in and out. And if your mind is still busy, I want you to give your mind the job of just saying, I am breathing in as you breathe in, and I am breathing out as you breathe out. So only 2 things to remember here, focusing on the feeling of the tummy rising and falling as you breathe in and out. And if you wish, giving your mind that job to say, I am breathing in, I am breathing out. So this will help you to close the open files in your head. And why is this important? Obviously, so we can concentrate, that we can be productive, so we can bring our minds back to balance. But imagine if you're cooking dinner and you use the pot from yesterday without cleaning it. how will the food taste? And if you use the pot from last week or last month, the food will be contaminated, might even poison you. But that's what we do with stuff, with stress in our lives. We bring yesterday's problems, we bring last week's problems, we bring last month's problems into situations. So closing the files enables us to bring a fresh perspective to each and every situation. So just a little refresher here about how the mind works. Averagely, we have 50 to 70,000 thoughts per day. That's 2,000 to 3,000 thoughts an hour awake and asleep. If our thought ratio is above 3 to 1, we're feeling good. 3 to 1 will just mean I'm okay. Thriving is 5 to 1. If it's less than 3 to 1, we end up in a downward cycle of anxiety, stress, depression. There's a Harvard study, and it says that the average person is present 52% of the time. So that means 48% of the time we're not present. So imagine how much more we could all be, do, and achieve if we could more present all of the time. So this simple practice and being present when we're in doing whatever we're doing, both of them will strengthen our mindfulness, and also reduce our stress and help us be more focused, productive, balanced, and resilient. When we fight things in our mind, we generate stress in the body. If I'm thinking one thing, doing another, feeling another, and saying another, there's conflict. My body turns into a war zone. If I want to be peaceful, it's important to have harmony in what we're thinking, feeling, saying, and doing. And I also just want to highlight here the importance of relaxation. We need to relax a certain amount every day, longer at the end of the day, on a weekly basis. And also just talk a little bit about screens. Most of us, so many people, they spend on average of over 4 hours a day on their phones, which breaks our concentration. So it's important that you're doing something on a daily basis to genuinely recharge your batteries and relax. And to just conclude with here, just remember that a diamond is just a piece of carbon that handles stress exceptionally well. So being resilient by choosing to grow, to learn from situations, by taking time to recharge our batteries when we need to, that's how we move towards being a diamond. So thank you all, and I look forward to hearing your questions.
Thank you very much, Calodagh, and thank you very much, Sally. I have a question here. If the average incidence of mental health issues is 1 in 4, adding the potential for vicarious trauma and stress in our workplace, aren't midwives more at risk, is the question. Would one of you like that one?
Yeah, there's lots of research out there to say that midwives are more at risk than the average person. It's a high stress occupation. As with paramedics, it's quite comparable, because we're seeing trauma on a daily basis. And while some trauma is expected, if you're working in accident and emergency, etc., some stress in our jobs is not expected. So we don't always expect mothers and babies to have problems, traumatic events to happen. And if it's completely out of the blue, that can actually be more harmful to us than someone who's expecting trauma to happen and therefore has that resilience prepared for those events. So yes, definitely, midwifery is a high risk profession for stress and distress.
Yes. The second question was actually about a midwife found the employee assistance program very, very beneficial after a traumatic event. Is there something similar as well in the NHS?
Well, the doctors have a practitioner health program where they become ill and they can seek help anonymously. But what we find with midwives is they generally don't want to go to their own occupational health services because that means them telling their employer effectively that they are unwell and their practice may be impaired by ill health. And as I said in my presentation, if they go to their GP, potentially if there's something that may mean that their fitness to practice is impaired by ill health, then that doctor has a duty of care to inform the NMC, or the midwife will have to inform the NMC. So help seeking is really quite difficult in this profession. It's the same with PMAs. You're talking to another midwife, you can confide in a colleague, but they have a duty of care as well. So it really is a complex issue we're dealing with.
Absolutely. I like the practicality of your presentation, Calodagh, with the negative thought ratio to positive thought. I think that that's a very easy thing that we could all get a handle on, and perhaps we need to do more about that and advertise it. How would you suggest that we might put that in place?
I suppose just to sit with yourself on a daily basis, take stock, notice particularly the patterns, because 90% of the thoughts that we have today, we had yesterday. So most of the time we'll often have kind of families of negative thoughts that we keep repeating. And probably 90% of those thoughts we had a few years ago, or at least in the same vein and the same pattern. So if we can identify, the core ones that we're always thinking about, right? And then start tackling them one at a time, it can make an enormous, enormous difference to just feeling more energized, alive, and positive about whatever today has to bring.
Yes, absolutely. And both of you spoke about resilience and the importance of that. And I think that that's a life altogether lesson that we need from our children to be taught upwards for us as adults working. And I love the element of putting kindness in there with that, just being kind. And I think those two things are perhaps the most important things for us to behave better to ourselves and to our colleagues as midwives and as people. Is there any tip else that you would have, Calodagh, on how to be more resilient?
I suppose the key point in terms of resilience is the concept of adaptability and the concept of learning. So when we look at our day, if it was overwhelming, what can I learn from that and how can I apply that? And maybe that just highlighting that one, that look back over the last 7, 8, 9 months, right? And I'm sure there's some examples of situations that you thought you wouldn't get through. And here you are today, and that problem got solved, and probably 20 other ones in the interim. So look back and see what core strengths did I demonstrate, right? Because those are your core strengths. That's your power, yeah? And so if you look at that, that can give you confidence for being able to strengthen yourself and to handle the future situations that are to come, yeah? I'm sure we all have many examples.
Yes. I would say that we do. The last slide that you had, Sally, was about the one that the research that helping nurses to build up their strength. And because that got cut off short in the timings, was there anything else in it that you'd like to highlight?
It was just how to ask questions, really, how to approach colleagues in talking about things. And it is important to talk and open up and reflect on how we're feeling. And people might not open up the first time you go to talk to them, or first time you say, how are you doing? How are you at this moment? People often say, I'm fine. But keep asking, keep that door open, and be authentic in sharing your own experiences as well. Don't pretend to be a hero, all of that kind of thing. And there is this kind of rhetoric that we tell ourselves about, the failure to cope. If we admit weakness, we're failing to cope. But actually, we're human, which I think has been a lot of the discussion today. And also, if you find yourself weak in resilience, that doesn't, that's not always your fault. It's not always your failure. And I think we can talk about people having resilience and not having resilience, and then sort of feeling bad that you're not resilient because you're crying or something. And that needs to be unpicked, really, in terms of forgiving ourselves and each other, and having that compassion for everybody's experiences to be really insightful. And yeah, hopefully we'll be doing some further research in future about that, and how we do cope and how we might cope better in those situations.
Yes, absolutely. I think that sounds perfect. And I think there's some really, really good working tips for us all, but for our lives, not just for our work as well. And for us to stay safe and healthy in ourselves. I think it's really, really important to have worked out what we're good at, as you're saying, Calodagh, and about being authentic. Sally, I agree totally. Thank you both very, very much. That was really, really, really good. And I look forward to reading more about both. Thank you.